Greetings, everyone. I'm Dr. Loarte-Rodriguez, and it's my pleasure to be here today to discuss the Nurse.org State of Nursing 2023 report. I'll introduce a little bit, I'll give you a little bit more background about myself, and then I'll turn it over to my co-host, Wali, to introduce himself and talk about himself. So I am an educator who went back to school and became a nurse, and I have over 18 years clinical practice in the OR, infection prevention, most recently primary care. But subsequently, most recently, I'm doing health equity research. Some other hats and lenses that I wear are that I am a daughter, a wife, a mom, as well as an Afro-Latina from the Boogie Down Bronx, but now I live in Connecticut. So that's me.
All right, everybody. It is so good to be back here. Dr. Tina, thank you for that introduction. And I'm actually really happy to be here with you because this is our first time collaborating on such a project. And I think this is going to be a very fruitful conversation because you and I couldn't be more different in terms of the clinical realm and the nursing world that we come from. So my name is Dr. Wali Khan. I am a certified registered nurse anesthetist, a CRNA. I used to be a critical care nurse, a trauma ICU and trauma resuscitation nurse. For roughly 5 years, I worked in a county hospital here in Chicago. I went back for my doctorate in 2020, so right at the peak of COVID. And that decision was not based on, the fact that it was COVID. This was something that was years in the planning, but it came to fruition in 2020. And so for 3 years, I was in school. I got my doctorate. I finished last year in May, and I have been practicing since. I'm coming up on the 1-year anniversary of being a CRNA, which is really insane because I can't believe how fast time has flown, that it has already been a year that I've been out of school and practicing. I'm really thrilled to be discussing this, I was about to say State of the Union nursing report, which really for us it is
for
the
Nurse.org.
It is Nurse.org's State of the Union nursing report, and it just sounds more grand too. Yeah. So, and I believe this is the third year that they have conducted this report to find out how nurses are really doing, because I feel like Nurse.org has become this avenue and this platform, and also like this this stage and microphone for nurses to where they're able to speak, what is happening and Nurse.org can do a pulse check and then kind of display and share that with the rest of the community and the rest of the world for what is happening in nursing, because so much of what we're going to talk about, the average person doesn't know. So it'll be new information for them, but then also nurses themselves. I feel like we become so bubbled in our own world or our own unit or our own infrastructures and facilities that we sometimes lose sight of what is happening in the larger scale of things like nursing. And in 2021 and 2022, the reports were digital health award recipients, and they help to amplify the real issues that nurses face every single day. So you can understand that there's a lot of pivotal issues that we'll be discussing that affect nurses every single day, no matter what you're doing, from, being a school nurse to being a researcher like yourself to being, a practitioner in the operating room delivering anesthesia like myself. It really hits home on all of these things.
Love that. And just to direct you all to Nurse.org to review the report in its entirety. It's really informative and laid out extremely easy to follow. Because of my research background, I actually wanted to start with the survey demographics and just highlight that from November of 2023 to about February of 2024, Nurse.org had a call out to all of its email subscribers and through social for nurses to respond to the survey. And thankfully, we got 2,427 respondents. But make a note, right? Like there's 4 million of us registered nurses in the United States. There's a lot of opportunity for more involvement and more feedback for next year's survey. So please, if any of these themes resonate with you, if you have an interest in having your opinion and your voice and your experience counted, be on the lookout for the next State of Nursing survey from Nurse.org, and please take those 5 to 10 minutes to complete it. just to go over some quick kind of high level demographics about the 2023 State of Nursing report. We have, again, 2,427 nurses who responded. Thank you for those of you who did that. A majority are registered nurses. We did have around 84% RNs. 5% were advanced practice nurses. And then thankfully, we did have around 11% of our LPNs, LVNs as well. For age ranges, interesting enough, we had about 43% of the respondents in the age categories of 55 and older. So again, we'll keep that as a reference point as we go back to some of the highlights, because that is the largest area of respondents. And then for those 25 to 40, that takes out the kind of the next biggest chunk of 25% of respondents. Not surprising, 93% of respondents were female. So males in nursing do exist. We did have 7% respond, and hopefully, again, as those numbers increase, and again, as the kind of awareness of the survey increases as well, we'll get that to increase as well. Thankfully, most of our respondents were employed full-time. And then also what I found striking as well was about 2,000 of our respondents were nurses that were practicing clinically as a staff nurse. From an education perspective, a majority or half of our nurses had bachelor's. As DNP prepared nurses, I do have to make that call out that is probably like less than 10%, if that. So definitely, some difference there. For specialties, again, not surprising, majority were in acute care, critical care, obstetrics, long-term care, emergency, and surgical. I would note that race ethnicity was not displayed in the demographics, as well as region. So just to say that we can't make those kind of nuanced comparisons based on those additional identifiers.
I think it's really important to talk about demographics and really, kind of put a pin in that so people can understand, okay, these are not some arbitrary numbers or, figures that are sitting in offices or some nurse administrator who's never been in the trench or in the field. Like, these are everyday folks like you and I that are going to work every single day. They have a pulse on what is happening on the units, what is not happening in the units, what is not happening in the hospitals. And, the responses that we're getting are in real time. So discussing the demographics of the survey and how the survey was broken down and conducted is really important to keep in the back of your mind that, like, man, these are people just like me, just like you, and this is what's happening in our profession. So let's get right into it. Let's get right into the meat and potatoes of some of the highlights of, what you guys are saying. And I say you guys because you are an extension of us, and we are truly one body, right? We're one profession. And that's kind of the beautiful thing about this profession, that we can be so diverse and in so many different areas of healthcare, yet we face similar challenges and similar problems. And then when we find a resolution to those problems, well, this report speaks to what happens. So 44%, now remember, this is, a sample size of almost 2,500 people. So we're going to base that these are the people that are responding, because obviously the rest of the folks who didn't respond back were not accounted for this. 44% of nurses replied that they were happy they chose nursing profession versus 2022, and job satisfaction rose 64% from 2022 to 2023. And I feel like this is a huge thing that we really got to break down, Tina.
Absolutely.
How can things change so much in 1 year, right? Yeah. I remember last year, everybody's like, I'm leaving nurses. I hate it here. No one listens to me. I'm burnt out. I'm tired. I'm not valued. I'm not loved. I'm not appreciated. Bye, right? Like, this whole thing was happening. And in the span of 365 days, you have to ask yourself, and I'll ask you, right? What changed?
Yeah.
What changed? Like, what changed? That you have 64% people responding saying, I am satisfied with my job, as opposed to 1 year before, I'm out the door. What changed?
There's so many things that I can reflect on. I mean, the most obvious one for me is, the emergency pandemic declaration ended, right? Like COVID finally officially ended, although COVID's now part of our everyday life. But the increasing in available testing, the increased vaccination rates, the I believe the increase in PPE and the emergency funding that went into kind of to stabilize, the staffing challenges, crisis that, that we saw in 2020, 2021, 2022, really, I think, righted itself in 2023. And the other piece too to that, I think, is that the nursing profession has really been able to stand up and say, you need to recognize my skill, you need to recognize my expertise, you need to recognize my value, and you need to listen and work with me, work with us to improve our work settings. And so I feel that that momentum has definitely started to shift more in 2023.
And we were spoken before the podcast, and I said, this reminds me of a story of Malcolm X and Malcolm X's childhood. And for those of you that may have read the autobiography of Malcolm X by Alex Haley, there's a very important point from his childhood that he mentioned that really stuck with me for the entirety of my life ever since I learned about him and his remarkable story, which is, he comes from a large family and he had many siblings. And obviously his father was, killed by the KKK, and his mother was raising these children by herself. And you can imagine being the youngest of 7 or 8 and wanting to be noticed and wanting to be heard and wanting things for yourself. But your mother has to get to all of your other siblings, and then you're the youngest and kind of like forgotten. And so he recalls the story when they would be sitting at the dinner table and he would make the most noise. He was very verbal and he would always seek attention because he wanted to eat. He wanted certain things for himself. And then he kind of fast tracks and talks about it. And he says, I learned a lesson from my childhood that if you want something and if you want it bad enough, you really have to make noise. You got to be noticed. You got to be heard. And that goes back to the saying that closed mouths don't get fed. And so nurses, I believe, exemplified that model, is where they made noise, enough noise that people that neglected them and didn't listen to them or didn't even hear them were forced to hear them, were forced to listen to the complaints. And they're not just like, petty, tedious complaints. They're like, hey, these are real life issues that are affecting us and our patients, and we can no longer do our jobs because you have not been listening to us. And enough noise was made between the year 2020, 2021, 2022, and enough walkouts happened, enough strikes happened, enough picket lines were walked. And you know what? Now you're reaping the fruits of that harvest, where people are starting to feel a little bit more satisfied and a little bit more content and a little bit more optimistic about their profession. Because guess what? If nothing changes, nothing changes. Well, something changed, right? Something clicked inside all these nurses and said enough is enough. And now we're seeing people reporting this, higher job satisfaction, because guess what? Staffing ratios, although still not optimal, are better than what they were, right? Salaries, not ideal, and they're certainly not matched with inflation.
Nope.
But they're better than they were a year ago. So can we continue improving? Absolutely. Undoubtedly. We most certainly can. But it just shows us that we have room to improve, and we can improve because we have improved. And I think that's where this nurses were happier and more satisfied at work in 2023 comes from, because the complaints of the previous years, some of them have been rectified. Not entirely, but they have been. And that's a very promising notion as we continue forward into the future of our profession.
Absolutely. And just regarding kind of the other influences I've seen has been, to your point of nursing making noise, there's been a lot of work for policy, right, to actually change some of the requirements for staffing committees or staffing ratios, to help kind of have nurses practice to the full extent of their license and their scope of practice. And so I think, again, nursing is on the journey of continuing to increase the professionalism and the and demand kind of that recognition and that seat at the table for these critical conversations that influence us as a profession, but then ultimately the patients we care for, right? Like we're the largest workforce group in healthcare. You know,
Right.
we are healthcare. We need to
We are
be
healthcare.
we need to be accounted for. We need to be at the table. We need to have all of our experiences and our opinions listened to, and part of the solutions that are going to be needed to continue with the other changing reality of, the demographics of the United States, as well as healthcare and the nursing profession.
And I found this to be very interesting, and it may seem that you and I are kind of biased because we
Mm,
are currently of this degree that we're going to talk about, but I really want to speak about it from an impartial standpoint, just kind of like an outsider looking in. So nurses and this is a highlight, but also a point of discussion here of this
yeah.
report, that nurses with higher levels of education continue to report higher job satisfaction rankings in 2023. And about 68% had a postgraduate certificate or diploma in 2023 as opposed to 51% in 2022.
Mm-hmm.
Meaning people understand that if I want to be respected, if I want more pay, if I
Mm,
want more knowledge, if I want an increased scope of practice, if I want more skills in my life, if I want more respect, and I want to feel more dignified, then I need to change my own status quo, right?
right.
I need to become more educated. I need to become more resourceful and more
Mm,
valued, right? And those are key words, because when you are
mm-hmm.
resourceful and valued, well, people will see your worth. And when they see your worth, you will be compensated for your worth.
Right.
And that kind of forms this beautiful little sphere of satisfaction.
Yeah.
There were 64% that had a doctoral degree in 2023, as opposed to 32% in in 2023. There was about 64%, as opposed to 32% in 2022. Now, obviously, a doctorate takes 3 years to perform and attain, but the fact being that they were in the process of obtaining their degree, and now in 2023, when they answer these questions, they're substantially more satisfied working as, a head clinical researcher or a CRNA or a
Mm-hmm.
midwife or a nurse practitioner, and they're practicing to the maximum extent of their license. And that is much better than what they were doing at the bedside. People that had an associate's degree, they have lesser job satisfaction. People that have
Mm-hmm.
just a bachelor's degree compared to those that have a master's or a doctorate. And this is not me speaking anecdotally. This is people speaking based on their lived reality and what's happening to our profession. Is that when you make that sacrifice, and it may not be for everyone, because not everyone can
Mm-hmm.
afford it, and I don't mean financially. I mean, you're a mom of 3 kids. You have teenagers.
Mm-hmm.
You have 3 kids at school. Before we got on the phone, you're like, "Hey, can we hold that conversation for a second? I gotta go make dinner. My husband's gonna come home too. My kids gotta be fed." But guess what? You're also a doctorate level trained nurse that has a
Right.
day job. So it's
Right.
like you're putting on a lot of hats to do
Yep.
this. For some people, it's not worth it, or they
Right.
can't, or they don't want to, and that's okay. But understand that on the other side of that struggle and that sacrifice, there is greener pastures and there is reward to be had. And this, report that we find is a testament to that fact. And
Mm-hmm.
so if you're somebody that's looking for more satisfaction out of your work and out of your life, your professional life speaking, right? There's an opportunity that exists, and you can do that because we have the numbers to prove it and people are speaking.
Right. Right. No, and I mean, again, you called this out earlier when you started on this theme, but we definitely have a different experience and a bias because we are both doctorate trained professional nurses. But internally for me, like I've always been an avid learner, and I always knew I wanted to continue my educational path. But unfortunately, early on in my nursing career, I didn't know the avenues to do that. When I first trained, it was, again, because I'm a second degree nurse or second career nurse, the training program I went through was a master's program to be an advanced practice nurse, but I hadn't even been a bedside nurse yet. And so I knew at that point I didn't want to go complete an advanced practice degree without having the initial clinical experience. And so I said, that's not for me now. And I'm going to learn and be a nurse at the bedside first and foremost. So that was something really important to me. I wanted to have that clinical experience before I went back to get my advanced degrees. The other, I think, reality too that I saw as a nursing student and then as a young nurse was that I didn't see a lot of people like me in either my universities or in positions of leadership at the organizations I worked in. So, I often share about how I was the only, and sometimes to this day still am the only in certain groups, in certain venues. And for the reality for many of us is that if you don't see it, you don't believe you can be it. And so I think there's also the reality of having, the nursing pipeline be really reflective of the population being aware of and transparent with the data regarding, their applicants, their matriculation, their graduation, the professors as well. And also translates to, clinical practice with all levels of nursing, bedside nursing, nurse leaders, nurse executives, and nurses on boards, right? Like as the higher you get up, the less diversity you have within those groups. So I've also really been curious about, those realities and if there's other things that the nursing profession as well as healthcare organizations should be doing to kind of sponsor and mentor, these vocationally trained nurses or certificate or diploma trained nurses or bachelor's prepared nurses to understand that you can continue to grow academically and still have a place at the bedside. Because I think the other reality too is that people think once, I have a terminal degree, I have to be in an office or I have to be, not clinically practicing. And that's not true, right? Like we need these other experts with these other unique skills to be still in the clinical practice in all settings and in all specialties to just continue to enhance and elevate the clinical practice and the expertise that we bring. And so just a little plug there. You can go back to school. Time is going to pass regardless, right? The year, the 2 years, the 3 years is going to go by regardless. Don't doubt that you can't go back to school. Look for programs that fit your life. As a mom of 3, I did an online program and that worked for us. And also see what opportunities there are for being able to pay your tuition or have your loans forgiven or any other financial opportunities to help cover it, because unfortunately school is expensive.
Here's a interesting tidbit on what you just said. Now, you were very encouraging, and the mom in you came out, and you're supporting and the teacher, and you're supporting people. But here's the other side, and maybe it's the dark side of what you're saying. Many of our respondents, nurses, felt unsupported by their nursing units and mixed about their opportunities for advancement. As straightforward as what you said, and as straightforward as what I said, like, hey, go back to school, grow, make more money, learn more skills, be happier in life, right? Unfortunately, that's not always an option, or immediately an immediate option, because there are some hurdles and challenges that exist within the workplace that may prevent people. And now we're talking about external hurdles outside of like your family circumstances, outside of like finances. This is really just the mental hurdles that exist. And the question that Nurse.org asked was, do you agree or disagree with the statement, my nursing unit puts the support of nurses and patients over profits? And nearly 60% of nurses didn't feel their unit supported nurses and patients over profits. And I want to read a quote to you from one of our respondents. And they said, there are channels to offer feedback, but nothing seems to be done about them. Additionally, a lot of the opportunities for advancement are based on political decisions and who is going to be a yes person and make the higher ups happy versus who is going to do what is best for the staff. That's really interesting
Yeah.
because all of these nursing administrators and higher ups were once nurses, right? Like bedside clinical nurses.
Yep.
And they were fed up with status quo, and that is what led them to want to change and be something different. But then they become the type of person that feeds into the vicious cycle of apathy, where once they get to that position where they thought they would make change, well, now they have become that yes man, and they do whatever they can to appease, the hospital higher ups, and neglecting the very covenant which they took to change the very conditions from where they come from. And I feel like that is what that is speaking to. And the other aspect of what this is speaking to is people are envious and jealous and petty that you will make the decision in your life to jump ship to pursue something better for yourself. It's like, hey, why is Tina going to go and get her degree and be a DNP when we're all here working our butt off, night shift, short staffed every day, not having vacation, can't call off, can't do nothing. And she's just going to go off to school and seek a better life? Why? Right? Like, and there are people that have that type of animosity in their hearts, or there's nursing supervisors or nurse managers that are like, look, I can't afford to lose Tina as staff. I simply can't.
Right.
So they may actually become a hindrance to your growth, or not write that letter of recommendation, or,
Right.
Whatever else the case may be. That is still a real issue. And, we were sharing all this positivity about how everyone's happy. Well, just hold on. There's
Yep.
things to be addressed. And this is one of them,
Yep.
where nurses still feel that the unit puts profits over patients,
Yeah.
that they put profit over the growth of their staff, and say, hey, look, we see that you want to climb higher. Can we make that a reality for you? No, you can't, because you don't have a replacement, because you've treated people poorly and your staff doesn't like being here.
Right.
So this is a reality, and 60% people disagreed. Only about 18% said they agree, that they feel supported about advancement, be it, advancement in the unit, in the hospital, or even pursuing a secondary degree to advance their career options.
Yeah.
Now, the segue to that is really interesting, because nurses reported higher levels of job happiness in 2023, with fewer nurses looking to leave the profession. So let me just say this before I hand it over to you. Nurses don't want to leave. Okay? No one goes through schooling, no one works the bedside with the initial intention to say, well, I'm going to get the job and then just quit and leave. That's not why people become nurses. I mean, there's many reasons for why people become nurses. And I can only speak to mine, and you can only speak to yours, but people don't come into the profession with the sole intention to leave the profession.
Right.
Something drives them out. So in 2023, we're seeing that nurses were happier in their current roles. They were less likely to change jobs or leave the healthcare profession. And, we asked, when I say we, Nurse.org asked a question, and they said, which of these statements best reflects your thoughts about your current job? Can you guess what people said, Tina? What was the leading response of what people said?
The unit of why they want to leave.
No, which of these statements best reflects your current thoughts about your current job?
Oh, that they're pretty. I'm good. I'm chill. Like things are good.
I'm chill.
Yeah.
Literally, 36% of the people said, I am happy where I am.
Mm-hmm.
That number was 13%
Mm-hmm.
in 2022, and it was 10% in 2021.
Mm-hmm.
So clearly, we're headed in the right direction because people are like, I like my unit. I want to stay here. I want to work here. I feel good when I come to work, and I do good work, and I'm not looking to leave.
Right. So a couple of points come to mind for that. And again, just to bring us back to the demographics, right? Like 43% of our respondents were 55 and older. So that has a huge impact, I think, on some of these responses. These are people who probably are more financially secure, maybe have the opportunity to retire soon. And again, as we talked about earlier, there's been some stability in healthcare from 2020, 2021, 2022 to 2023. I think the reality regarding that misalignment between I like being a nurse to feeling supported as a nurse over profits is because also the after effects of the pandemic, right? Like all of this emergency funding is gone. These healthcare organizations, for better for worse, whatever it is, they need to now figure out how to hopefully break even to sustain, right? Like services. An underlining piece of this is that unfortunately, the bedside nurse is not a direct bill service for reimbursement. And so our value, our contribution to patient care, to patient outcomes, is not able to be really appreciated in healthcare because of those limits. And the other, I think, reality too, speaking from somebody who was a healthcare leader, a healthcare executive, is that there is so many competing priorities in balancing the realities of safe patient care, high quality patient care, patient-centered care, with staffing engagement, staffing retention, staff professional development, staff training, right? Because we know our nursing students did not have the same clinical training and opportunities that we had because of the pandemic, and that's a reality, right? Like we have to be honest about that and reconcile that. And the fact now too is that many areas don't have the direct ratio of one unit to one nurse leader, right? Now there's one leader for like 5 units and over 100 people. And there's very, very few organizations that I know, even industries I know, that with that ratio of leader to frontline staff that can have meaningful relationships and conversations to really, be able to say, Wali, I care about you. You're an important person. You're an important staff person to me. Let's connect. Let me hear about, what are your barriers? What are your aspirations? How can I assist you? And so, that I think is also a reality of it. But I mean, to your point again, there's so many layers and layers of the onion to unpeel from the State of the Nursing report. And so again, we're just touching a few of these pieces. So we encourage you all to go to Nurse.org to learn more. And we encourage you to take it back to your units, take it back to your nursing circles. Ask if they knew about the survey, if they answered, and how they feel about some of these. Because by having these conversations, to be able to understand the data with its limits and its opportunities is critical for us to continue these conversations and this work forward.
100%. Very true. Now, let me ask you something. This is a point of, discussion in every circle, because this is really what drives a lot of decisions. It's what drives a lot of actions, and it really what drives a lot of people is salaries, is money, right? Money talks.
Yep.
Money talks. Money also walks. It makes people walk away. It makes people walk to things. It often makes people run to things.
Yep.
58% of nurses reported a pay increase in 2023. Keep that number right there for me.
Right.
58% of nurses reported a pay increase in 2023. But nurses still felt that they were underpaid. 29% of nurses supplemented their pay with a secondary form of income. Like, why?
Exactly.
Like, that's the question, right? Like, why?
Yep.
Why the hell do you have to work a second job just to make it? What has become of our society? What has become of our, way of life that one job no longer cuts it? And I'm not even talking about just having some extra spending money or like some petty cash, but like to
Right.
make ends meet, to raise 3 kids, to
Yep.
pay your home, your rent, your mortgage, the groceries, the care for your dog or cats that you may have, and your life insurance, your health insurance, your children's insurance, and then try to have like a nickel and dime left over for saving for the God forbid money.
Right.
And in order for you to do all of that, you have to have a second job.
Yeah.
Which is like, that sucks. Like,
Yeah.
as if it's not enough to work, your 40 hours, your 50 hours a week. Now you got to have a second job because guess what? Inflation is insane. If you're trying to buy a home, the mortgage is insane. The interest rates are crazy. The house values are inflated. And your $60,000, $70,000, $80,000 a year job just doesn't cut it anymore. So you have to find another job. You got to have a secondary income. And that's stress. That's added stress onto having just a regular job. 58% of nurses reported a pay increase in 2023, but yet they still have to have a second job because fighting for greater pay didn't resolve the issue. Because you also have to keep into consideration what the outside world looks like. I mean, everybody talks about how nurses in California make so much, man. They make 6 figures. Yeah, their rent is also $4,000 a month for a freaking one-bedroom apartment, right? They're paying $4,500 for, a 900 square foot apartment, right? Not including utilities and groceries and cost of living.
Yeah.
All right. Nurses on average earn between 60, and a lot of people don't know this. I think this is transparent information that if you just do a few Google clicks, you can find that information. But nurses on average earn between $61,000 to $91,000 a year in 2023. And if it's not enough, if $90,000 is not enough for you to live and you have to get a second job, something is wrong.
Yeah.
Something is deeply wrong with our society, with the way that we are moving forward.
Yeah.
And I'll give you some statistical figures just to kind of, put out into the air. Of the people that answered, only 4% are making more than $100,000 a year. Only 4%. Right? People seem to think that nurses get paid so much for the work that people do, for the cost of living factors. That is not enough.
Right.
Especially when you have children. 3, 4, 5 children, 2 children, or even a child, singular. Right? You
Or
have to
other dependents, right? Like sometimes we're taking care of our parents, our aunts, uncles, anybody
throw in the
else.
factor that somebody may have a chronic illness that requires, additional income that has to get allocated towards that. If you have kids that are in college that you actually have to pay for, textbooks, school expenses. And I mean, I'm just talking as a normal average human being now, right? These are needs that all of us have. And this is one of the points of contention that nurses have is like, you're not paying me enough, so I got to go do something else. And that takes us to the next point, which is, listen, 29% of nurses had a secondary form of income in 2023.
That blew my mind.
Right.
Again, we're
Um,
highly skilled. We are the foundation of healthcare. We are critical to so many settings and practices. Yet that number is insane that we have to have a second job.
even 3 jobs.
Yeah.
Um, where are these second sources of income? Let's talk about that. About 26% are working per diem shifts. Right. I'll pick up another job, a locums job, a 1099 contractor job, which will pay me double, almost triple the hourly rates that I'm getting paid on my unit. And I'll pick up more over there than I am at my unit. I'll call in sick on my unit and go work a
That's right.
shift.
Yep.
Not me like Wally, right?
Correct.
But
Right. It happens.
it
It
happens,
happens.
right?
Yep.
I'll do that because I'll get paid 3 times as much to do the same
Right.
work. Or I'll work in a lesser acute area and make twice, thrice as much.
Yep.
People have non-nursing side hustles, second jobs. Like you may be a night shift nurse, but then you're a nanny on your off days.
Yeah.
And being a nanny in one day pays you more than you would being a nurse for 2-3 days.
Yeah.
Plus the family you nanny for pays for your food and covers mileage, right?
Yep.
People are working overtime shifts. Man, it's bad enough to work your shift. Like this is coming from a critical care nurse, right? A former critical care nurse. Like working 12 hours, taking care of vent-dependent patients, right? Giving them all of their care that they need. And then getting that 1 or 2 days off, but then saying, you know what? No, I got to go back to work another shift because I need more money.
Yep.
And now you're working 6, sometimes 7 days because you need the money.
Yep.
Right. There are people that are nurse writers, these incredible articles that you see about your profession and research, right? That's the second job. And there are people that are using the likeness of being a nurse, the likeness of being able to wear scrubs to do other things. People are, the term is nurse influencer. They become an ad or a spokesperson for various healthcare brands that will give them more money for posting a social media post than they may make in an entire week of working as a nurse. And that is more appealing and enticing than having your day job.
Right.
Right? But this is where nurses are going. This is what nurses are doing and how they're making their money. And I will hammer in this point, Tina. Nurses with higher levels of education were more likely to have a secondary source of income. Right?
Yeah. Yeah. And for me, I just wonder how much of that intersects with the satisfaction, right? And also feeling supported. Because if you're not supported at your workplace, but maybe you're already vested or you have seniority, so, you don't want to or can't leave there, but it doesn't fulfill you, it doesn't satisfy you, right? And so you then also go somewhere else, not only to make that extra coin, but potentially to get some of that enjoyment and satisfaction that you're missing from your primary job.
And speaking of satisfaction, I mean, pretty much across the spectrum, everybody reported a larger or greater increase in their job satisfaction in 2023. But this is really interesting. The highest level of job satisfaction was amongst ambulatory nurses. So working in surgery centers, outpatient settings, non-bedside nurses, pediatric, surgical OR nurse. And I believe that you yourself, right?
Correct.
Have that. That's where you started. You were an OR nurse. And these people still reported satisfaction, but these were the least, right?
Yeah.
Critical care, because it's exhausting, mentally, physically, emotionally exhausting. The float pool where you're just being ping-ponged all over the hospital.
Right.
They tend to be lower in terms of their job satisfaction, but it's interesting, right? Ambulatory care, working at a surgery center, Monday through Friday, 8 to 3, and you're out the door, no weekends, no holidays. Man, that's a good life for some folks. They can be there for their kids on the weekend, go take them out to their softball tourneys and, football and baseball and be there for practices, pick their kids up at school at 4 o'clock and be home for dinner at 5:30.
Yeah.
People want to be people.
Yeah.
Right? Nursing is just your job. It's just a profession. It's not your life. It's not.
Mm-hmm.
If it is, if you think that way, I would advise you to rethink, because you are, like you said in your introduction, a mother, a
Mm-hmm.
daughter, a sister, a wife, right? A caretaker. Those are things that define you,
Right.
because you do them every single day for a majority of the hours of your life.
Right.
But when it comes to professional satisfaction, there's a reason why those particular specialties are more satisfied with what they're doing.
Yeah. Yeah. And again, just the switch to kind of the settings, right? Like ambulatory nursing is very niche, right? Like it's kind of, I know what I'm expecting, and
Yep.
because of the business model, because of the functionality, the role of it, there's less discrepancy, less, anticipation. Although I worked in primary care and I know every day was a different day. But compared to what is happening at med surg and in the critical care areas, that is a stark difference. And the other piece too is that as healthcare really pushes the patient out into these other areas, right?
Mm-hmm.
There is that ability to still take care of complex patients. But again, to your point of being able to do that in a 9 to 5, Monday to Friday,
Mm-hmm.
no nights, weekends, or holidays, to have snow days or bad weather days, right? Like that's not reality of the acute care and patient world. Like regardless of what's going outside, we need nurses inside to care for the patients. So I
So
think as healthcare continues to evolve, that will also be, and as the care gets dispersed into other settings, it'll be interesting to see how these reactions trend.
So these next two things that I'm going to mention, they're very interrelated, and that'll kind of take us to our close for this discussion. We asked the nurses, we said, if you're planning to leave your current
Mm,
nursing position, why are you deciding to leave? And before I give the answer, I'm actually going to ask the second question that we asked them. And we said, if you are thinking about leaving your nursing position, what are your career plans? So first
mm.
is, why are you leaving? And the second is, what are your plans? Like, all right, if you're leaving, where are you going? First one, why are you deciding to leave? Can you take just a wild guess and throw that dart in the dark why they're leaving?
Money.
There you go. Ding, 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 right? Drum roll. Money. Show me the money. All right? Money. Number 2, administration.
Yeah.
Number 3, staffing,
Mm,
right? If you have people that won't listen to you, why do you want to continue talking to them?
right.
You don't.
That's the definition of insanity. Stay in the same place thinking things are going to change and they don't.
Number 3, staffing.
Mm-hmm.
If it's not safe for your patient, but before that, if it's not safe for you, you don't want to be there.
Mm, yes.
And these are the top 3 reasons for why those that are going to leave are going to leave. And if this applies to you, I feel for you.
Right.
But let's connect it to the second question, which is, okay, so you're going to leave for more money, for admin, for staffing. But what are your plans? Number 1, I want to leave the bedside.
Yeah.
It's not doing it anymore. I don't want to deal with nursing managers and in-house supervisors and, cranky coworkers and terrible family members. I need to do something different.
Right.
Can you guess what that translates to? Ambulatory service,
Mm-hmm.
right?
Yeah. Or nurse entrepreneur, right?
Nurse entrepreneur, or being an OR nurse, right? Which is one
Yep.
of the leading things, is like, okay, not going to deal with this. I know what
Yep.
surgeries are scheduled. I know what time they start. I know what time they'll finish. I know my call schedule. If I'm on call, boom, 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 done.
Yeah.
Right? One and done. No holidays. And if I'm not taking call, no weekends. Number 2, I want to go back to school. And that's why we said people with secondary education or secondary degrees have reported an increased job satisfaction and also life satisfaction. They're happier. They're making more money. They have more skills. They have more knowledge. They are more valued. They are more resourceful. And
Right.
therefore, that's where people are going. And your 2 hosts that you're listening to right now, that's the path that they pursued because of these very reasons. And then number 3, they said, I want to do per diem nursing, which I believe relates to number 1, which is more money. Nobody wants to do per
Mm,
diem nursing because it's fun. They're like,
mm,
hey, I have some free time, rather than me doing something productive with my life and investing in my interests and hobbies, let me do a per diem shift. No, it's because people want more money.
Yeah.
That's what it comes down to. And healthcare cannot adequately function without nurses. And thus, the end all be all, once again, is that we need to be treated better, respected, heard, and paid better. That is the answer to your nursing shortage. I've said in my podcast, there isn't a nursing shortage. There is a shortage of people willing to do crappy jobs in crappy circumstances and conditions with crappy people. That's the shortage, right? Staffing levels and the reason I say that is because staffing levels marginally improved in 2023. And we still have a long, long way to go with where we are. But we are, like I said, headed in the right direction. The shortage is not due to a lack of nurses. It's due to nurses being fed up with current conditions, and that's why they leave.
Yeah, most definitely. And that applies. Well, this report was focused on our clinically practicing nurses. It extends throughout the entire pipeline, right? Because again, 42.5% of our respondents are 55 and older, right? Like the workforce is going to retire. And that reality of not having sufficient nurses in the pipeline to fill those ever growing vacancies is going to be a huge crisis. But to the point of, there are 4 million nurses, right, out there. I know in my state alone, there's an abundance of nurses who have active license who said, no, I'm not working. And to your point of saying they left the bedside because it's just enough was enough. And they have spoken with their actions by not applying for jobs, leaving jobs, exploring other opportunities. And it's just really critical that we continue to use our voice, use our platforms, encourage our and support our participation at those tables where decisions are being made, becoming more active in boards and even running for office, right? Like a lot of this is going to happen, unfortunately, in legislation, because healthcare needs to be mandated, it feels like a lot of times, to do the right thing. So it'll be interesting to see, how our nurses are feeling over the next couple of years.
And I would just leave with these two conclusive words to our listeners. When Nurse.org sends out this survey, please respond, because we want to hear from you, need to hear from you, because this is the way that we keep a pulse on our profession. This is the way that we connect with you to give you what you need based on what you have asked. And of course, there's limitations to this survey. One of the limitations being that when you send it out, people don't answer. And how will we know how you're doing if you don't tell us how you're doing? And then just, Nurse.org cares about nurses at every stage of their journey. Whether you're just thinking about nursing, whether you have thought about nursing but don't know the next steps, there's a lot of support and empowerment that's there for people to better their careers, their lives, and their profession. And so there's a lot of published, trusted educational resources that you can find on Nurse.org. And also, if you want to go through this, this report that we have discussed, please, the entire report is available on Nurse.org. You can go there. You can subscribe to, many of their social media networks, such as Instagram, Facebook, YouTube, and you'll find, many beneficial things that will help you in your career. Tina, thank you so much for being here. I really enjoyed our conversation. I think this is really important to have a dialogue around this, because many people are unaware of what is happening within the profession while being in the profession themselves. So I was really grateful for this opportunity.
Same here, Wally. It was a privilege to connect with you, learn a little bit more about yourself, and just, express our insights and experiences through the State of Nursing report. And so it's been an honor. Thank you.
Thank you.